Disabilities and Addiction Committee members. My name is Eliot Thompson, and I am the Outreach Coordinator, and I run the syringe exchange at the Alliance LES Harm Reduction Center. We're a care management and harm reduction nonprofit that has helped tens of thousands of New Yorkers since 1991, and I'm here to give my strong opposition to two proposed bills, Intro 868 and 1169, that I believe would increase infections and fatal overdoses in New York City. Harm reduction means using evidence-based approaches to reduce the personal and systemic harms associated with drug use. It means meeting people where they are with compassion and respect. I do outreach in our community, mainly in public parks, distributing sterile syringes, sharps containers like this one, Narcan, as well as medical supplies, socks, food, and other necessities to people that need them. This work is twofold. One, it helps an immediate critical need, and two, it builds relationships with our participants so they will trust us and come to our center to receive more services. This approach is not enabling. On the contrary, according to the CDC, people who use SSPs like ours are upwards of 5 times more likely to receive treatment for their substance use and upwards of 3 times more likely to reduce or stop injecting drugs. Narcan distributed by us was used at least 53 times to reverse overdoses last year, and that is just from people who reported it back to us. Our work saves lives and it gets results. It is to protect our work that I oppose Intro 868, prohibiting the distributions of hypodermic needles by mobile syringe service programs within 450 feet of schools and playgrounds. I presume this bill is intended to keep people who use drugs away from kids, but I assure you our participants are not interested in interacting with kids. Many of them are experiencing homelessness, and public parks, which are often near playgrounds and often near schools, are some of the only places they can go without feeling like they're being hassled or feeling like they're in other people's way. Essentially, this bill makes being homeless illegal in the only places we've allowed the homeless to be. This bill is morally cruel, but it's also impractical, because to help someone, you have to be able to find them. Our people are in parks, we know they're there. They're not trying to coerce or interact with children, they're looking for a safe place to be. I oppose this bill because it would cause the increased persecution and harassment. I oppose the bill because the life-saving work of distributing harm reduction supplies, including syringes, should not be restricted to areas far from parks and schools. If you're worried about syringe litter, help us pick it up. Don't criminalize the existence of an already precarious population. I also oppose Intro 1169, safe collection and disposal of needles and syringes. I oppose this bill because it invites an unacceptable risk of accidental syringe contamination or needle sticks. At our harm reduction center, we collect syringes in large sharps containers and pay a specialty company to collect them safely when full. We also distribute personal sharps containers to our participants like this one. These containers prevent infections and should be everywhere. We fully support a DOHMH database cataloging large sharps containers in every neighborhood. We hope the city will fund the installation and collection of these like community trash and recycling bins. We appreciate the good intentions of the bill, but object to requiring harm reduction centers to provide disposable receptacles in each program location in areas that are publicly accessible at all times. Our system works. Participants ask us for personal sharps containers and return them to us for us to dispose of. We build trust with our participants, and the system prevents people from absent-mindedly taking out their used syringes. Instead, we ask the city fund additional large sharps containers and more small containers for personal use. Please vote no on Bills 868 and 1169. Thank you.
Thank you so much. I have questions for you guys.